Dr. Carol Paris is joining us. She's a psychiatrist in private practice in Maryland, also a member of Physicians for a National Health Program. Dr. Paris, it's great to talk to you. I think a good place to start will be to get your sense of why you think a single-payer national health care program would be a better thing than we have now, but also I'd be curious to hear why some of your other colleagues, other doctors, aren't unanimous in that idea, if it is beneficial, as I believe you think it is.
Well, thank you for having me on the show. Yes, I do think that it is beneficial, and there's lots of statistics we can talk about or not to support why it is beneficial, both for physicians and, most importantly, for 95% of the Americans in terms of just economically advantageous to them, not to mention giving them comprehensive coverage. But why do so I think it's beneficial both from an economic standpoint and from a moral, ethical, healthcare is a human right perspective. But even if you don't approach it from that perspective, just from an economic standpoint, it is superior. Why do I think other physicians aren't on board with it? Well, actually, 59% of physicians that were surveyed back in 2008, and remember that's even before the Affordable Care Act, 2009 legislation, said that they thought that a national health program would be superior, and that was up 10% from 5 years earlier. That was published in the Annals of Internal Medicine. And just if you look at the numbers of membership in Physicians for a National Health Program, our membership increased by 3,000 or 4,000 physicians in 2009, simply because there was so much more awareness of the problems with our healthcare system, even though there was not a great deal of public media awareness of single payer as an option.
So let's talk about that a little bit. I mean, I think on this program we talk a lot from the patient point of view, why a single payer system would be better. But as a practicing physician, I'm curious what your thoughts would be about how would that allow you to provide better care, or would it affect, how would it affect the income of the average physician? I mean, go into that a little bit.
Oh, I'd be glad to. I got into this, as I said, I joined PNHP in 2009, and that was after I had spent 4 or 5 years with our the Maryland State Medical Society, and I was very active in the State Medical Society, and I was quite proud of a piece of legislation that was instrumental in getting passed, that was designed to get the insurance companies on one particular issue to play fair. And when it was all said and done, when the regulations were written, they were written by the insurance companies, and there's no fine for violating the law. And it was at that point that I just said, there is just something wrong with insurance companies. No matter what we do, they will find a workaround. They will find a way to get around any legislation that you pass. And that's when I got involved in Physicians for a National Health Program and started looking at putting a dollar sign on what that would mean for me in my own practice. And one of the things that I came across was an article in Health Affairs that suggests that the average primary care physician, the cost to the average primary care physician is $68,000, somewhere around $68,000 a year per physician per year, just as the cost of dealing with multiple insurance companies.
Okay, so this takes into consideration, if I understand, the average primary care physician. I don't know what numbers you're using. Is it a slate of about 2,500 patients that they have kind of on their roster?
I don't know what the number of patients is. This was published in Health Affairs.
Okay, so
and
but the idea would be that the average physician
yeah,
with an average patient load, because of both billing and timing put into working with insurance companies, would stand to save $68,000 if that bureaucracy was eliminated.
that is correct.
Okay, now as far as care is concerned, does it just follow that simply by not having to deal with that, you're providing better care? Well, I think usually you have people working on the billing side, so I don't know that that's the argument, but how would it translate to better care?
Well, actually, the people that I have working on the billing side are medical assistants. They could actually be doing blood pressures and weights and actual things that would be good for my patients rather than answering phones and chasing prior authorizations. So from that perspective, it would be good for the patients. Plus, if I'm getting a raise simply by not having to have so much overhead go into dealing with multiple insurance companies, then I might actually be able to see a couple fewer patients a day and spend more time with the patients that I'm actually seeing, which definitely translates into better care. I think if you ask the average patient what their feeling is about the amount of time that their physician spends with them, I don't think you're often going to hear that patients feel like their doctor spends as much time as he or she need, or at least from the patient's perspective, that the patient feels is necessary. And I don't think that's because doctors don't like to spend time with patients. It's because we're like hamsters in a cage. Unless we see a volume of patients every day, we can't pay the bills. We can't pay our staff and have any money left over for an income.
So on the last end of this, I guess my question would be about as far as, and this is probably an issue that has multiple influences, both the fear of lawsuits, but also what insurance companies will and won't cover, which is that of necessary or unnecessary tests that are often done. We just did a piece a couple of weeks ago about a number, I think it's 45 different tests that a group of doctors came together and said, you know, these are really overdone, and if people did them less, you know, in more specific conditions, we would actually eliminate a ton of spending. At the same time, a lot of the reason that those tests are being done is because doctors both need to cover themselves and know that if they're not done and documented, future procedures may not be covered. So talk a little bit about how the diagnoses and testing might change with a single-payer healthcare system.
Well, the argument is made that doctors do so much of the testing because they're afraid of being sued.
Right.
Right? And so when you think about malpractice, and you look at when you break a malpractice award down, the majority of the money in any malpractice award is to cover the patient for future medical care. Mm. Well, guess what? That goes away if we had a national health program, because that's already assured. You get your Medicare card the day you're born and you lose it the day you die. So necessarily, every malpractice award is going to be significantly reduced if we had a national health program, which then translates into a smaller premium for your malpractice insurance because the payouts are not what they used to be, which again translates into more income for doctors and fewer malpractice claims, because the majority of the reason that people pursue a malpractice claim in the first place is because they need to be assured of continued care. And if they don't have to be assured of continued care, then if it's one of those cases where it really wasn't malpractice, but it's equivocal and the patient's is going to have expensive care for the rest of their lives, that goes away with a national health program.
Okay, I wish we had more time. We've been speaking with Dr. Carol Paris. She's a psychiatrist in private practice in Maryland, also a member of Physicians for a National Health Program. Really great to speak to you, and we'd love to have you back again.
Thank you very much.